Hi, welcome to Renew. This is another case of the day. We do this every day, so I will start telling you a little bit more of what I see. This is a case, this patient has 3 implants. We're actually looking at doing the sinus secure procedure back here into the sinus. He doesn't have enough room for bone. But what I'm going to talk about is the restoring of this one here. It gives us a very, very good example of how the tissue actually remodels. And there's a nice picture and there's a nice result since this is all healed. We're still working on this. These are also good, but it really counts how the tissue folds over and meets the crown. As you go more forward into the mouth, you really want that aesthetic. And this is a nice subtle example of what we're always trying to achieve for the patient. Here is the picture of the final seat of his crown. We do all porcelain crowns 90% of the time. If somebody wants a porcelain bonded to metal crown, or we feel that a porcelain bonded to metal crown is the appropriate crown for that situation, it doesn't cost any difference. There's no savings or cost added. It's all the same cost. We're just looking for the best result. There's a third type of crown we might do. It's called a zirconia crown. And that technically is an all porcelain crown as well. Those are extremely strong, but those can have other issues. So everything comes with different types of properties, which you got to decide on what is the objective of what you're trying to achieve. So if you do a bridge, cosmetics, all these things come into play when you decide on the materials for the crowns. So this is a nice aesthetic. We're actually matching here. He wanted something a little bit wider. Everybody does. And we're coming into the smile. So this is the canine area. Here's the implant area. And here's the tooth area back here. Now he has a metal jacket crown here. And you see that kind of dark line of the metal that's showing up. Now not all metal jacketed crowns will show metal when the gums go away. Sometimes the tooth is very dark and it shadows from the metal and appears like it's metal. It's just dark tooth that you see. So that might be would be a benefit if he had that done in a feldspathic all porcelain crown that we typically do here. So here's this crown that we're bringing up, and he has a nice effect. He has a gum line that's very similar to his natural teeth. His tooth obviously looks natural up here. Now, when you take a tooth out, and this is the point, when you take a tooth out, see this bulge? There's a bulge that the tooth came from inside out and pushed the bone, therefore allowing the tissue to kind of bulge out and you get the bulge look. Now, when this tooth came out, there is no bulge because it remodels in. And implants go from the outside in, right? So natural teeth come from inside of you, they go inside out, and implants go from the outside in, which means we can't push that bone out to get a scalp effect. And when you come back to this tooth, it's a little bit more difficult to see, but you see it bulging again. Now this is a very nice aesthetic and turned out very well, mainly because he has a lot of bone. When your bone thins right here, or when somebody extracts a tooth, you want to preserve this bone as much as possible as you go forward. So one of the methods that we do, I do 2 different methods every time if we really see in the CT. That's what this CT is so important. The 3-dimensional image that we take when we start is so important because we can see how much bone somebody has. If you have a lot of bone, a graft won't matter. A graft will just support your natural bone, but you already have a lot of natural bone, so it won't collapse as much. If you have very thin bone through here, we don't want a defect to occur, so we will graft. But before you get to that point, you have to practice something that we call atraumatic extraction, and you just want to pull the roots out and preserve all the bone that you have. And then you can put the implant in or you do a graft to preserve it. But that's what we're trying to do in the gum line area. And the further up in the front, in the higher gum line smile is where we really have to be careful about implants because once implants are in and they integrate, you can have a success there, but have a cosmetic failure right around this area because this bone defect becomes too great during the healing.